Welcome to the Health Workforce Technical Assistance Center's webinar series. This webinar is entitled, Which Rurality Definition? The Relative Performance of 8 Federal Rural Definitions in Identifying Rural-Urban Disparities. And this webinar was presented on July 27th, 2021 by Paul Delamater, Julia Long, and Davis Patterson. Hello, my name is David Armstrong, and I'm the Director of the Health Workforce Technical Assistance Center. Today's event is the 5th webinar in our series on health equity, and it focuses on rural definitions and their impact on identifying rural-urban disparities. Now, with that said, I'm going to go ahead and turn the event over to our moderator, Davis Patterson. Davis is the Director of the Rural Health Research Center at the University of Washington. Davis?
Thank you, David, and thanks for this opportunity to moderate this session. It's made me going up on my rural definitions, and I'm really looking forward to hearing our panelists. And so the first panelist is Dr. Paul Delamater, and he's an associate professor in the Department of Geography, faculty fellow at the Carolina Population Center and the Sheps Center for Health Services Research. He is also an associate at the Lineberger Comprehensive Cancer Center, and he has a particular interest in research relating to the spatial components of, lost my view here, spatial components of healthcare access and utilization, as well as disease modeling. He employs GIS systems, geographic information systems, and statistical and spatial analysis to better understand population health issues. And then our other panelist is Julia Long, and she's a graduate of the Gilling School of Global Public Health at UNC Chapel Hill, where she's conducted research in rural health policy and health workforce development. She has particular research interests in underserved populations and access to care, and enjoys bridging the gap between research and evidence-based policy through data visualization and mapping. Julia now works at the Urban Institute in Washington, D.C., assisting with their work on access to healthcare for children and families. And so without further ado, I'm going to turn it over to Paul to do the presentation, and then we will have time for Q&A and discussion afterward.
Thanks so much, Davis, and thanks, David, for inviting us to this great seminar. And I also wanted to give a shout out to Mark Holmes, who is a co-author on this presentation as well. I'm going to go ahead and start the slideshow. So everyone saw the title of my talk today, which is thinking about definitions of rural and how they perform in identifying disparities. And I did want to mention that this is we have a paper coming out soon in medical care that's detailing the findings from this. So I'm going to jump right in because I want to keep the presentation short so we can talk about this. So, this work thinks about what is rural and thinking about this conceptual idea of rural. And we often think of this as an attribute of a place or the residents of a place. And things come up like population, how many people, how closely do they live together for population density. Other people may think about things like distance and or isolation, so distance from things. We also think about rurality in this concept as being something about the physical landscape. And other people think about it as some kind of economic connectedness to urban regions. And although we would all love to have one standard definition for rural, this is a multifaceted concept, and there really isn't any universal agreement for this. And a lot of people have been thinking about this for a number of years. So one of the things that happens is we think of this as who is rural, and we're thinking about trying to identify these regions and their residents. And what happens is it requires operationalizing these conceptual ideas about what is rural, operationalizing using measurable characteristics, so things that we actually have data for, right? We need measures or metrics that actually capture these characteristics of the regions or people that we conceptualize to be rural. Because there have been quite a few people who have tried these things. Another thing that comes in, because we know that it is this multifaceted concept, is you also need some kind of weighting or rating scheme, right? To combine or integrate different measures or metrics. And then one of the things that's going to come up today is this idea of some kind of threshold, where it's like, if we do want to draw a line in the sand and say these places or these people, residents, are rural and these are not, we have to have some kind of distinction, some kind of line. So we're thinking about this. In reality, we would probably all think that rurality is a spectrum, and that it's this kind of thing that there are some places that are very rural and some places that are less rural. And there have been some continuous approaches proposed to try to capture like this. But when I've given this presentation before, I'd like to say, but even more real reality, rurality is binary and rural is binary, because one of the biggest reasons we need, or people working in health services or health workforce think about this, is eligibility for funding for these various programs are based on rural status, and you are either eligible or not eligible. And that was one of the things that got us thinking about this idea of rurality and these definitions, and the idea that many federal and state agencies have their own definitions, and they vary quite a bit. And there's another quote from a paper: it's not unusual for one place to meet the rurality criteria for one program, but not another. This just happens. And so this is important because funding eligibility is determined by this, but there's also this whole body of researchers and research who are very interested in evaluating disparities or differences in health access and use, health outcomes, and things like health workforce based on rural and urban status, right? And so this concept, this idea is very important to a lot of people. I also wanted to show this Am I Rural tool that links in with the last concept here. So we have, this is the Rural Health Information Hub, has this website where you can type an address. This is actually where I grew up, in Little Lakeview, Michigan, in Mecosta County, Michigan. And it tells you the programs that this location is eligible for, and then basically the RUCA codes, the RUC codes, the urban influence codes, and things like this. So this is a really nice tool, but this is basically the kind of thing we were thinking of in this, that, you know, this one place on the ground could kind of be classified as many different things. So the main goals of our study was to look at these different federal definitions of rural, or definitions created by federal agencies, and look at how much they agree with one another. And then we also want to evaluate how population characteristics vary across these different definitions. So what we did was we actually used 8 different definitions of rural. And this was Julia, my co-panelist presenter, did a lot of work on this. She got all these data and consolidated and integrated them all. But you can see a lot of, if anyone that's worked in kind of urban and rural research or analysis probably sees a lot of things that they're used to seeing here, like RUCAs and RUCs and CBSAs, core-based statistical areas, and all these different ones. So we grabbed 8 of them. There are more. I think in our discussion before this talk, Davis said maybe there's more than 100 different definitions, and Julia was very happy that we didn't ask her to do all of those when doing this work. But we did 8. I'm going to stop there and move on, because I could talk about those all day. One of the things that we really think was interesting about this was Julia, when she was consolidating these and kind of coming up with which ones to use, she actually was looking at how they are kind of based off of each other in some cases, that they kind of build on one another. And so we built this graphic. And again, I'm not going to go through this whole thing. I just wanted to show you that this will be available when the paper comes out. And it kind of helps us classify or categorize these different definitions to help understand kind of what they are and where they come from. This also tells us we have some like dark shading and light shading, ones that are dichotomous, like urban, rural, just kind of baked in, and ones that are multi-level definitions. Okay, so what we did is for each of those 8 definitions of rurality in US, we constructed binary, rural or not rural, GIS layers using census tract level data based on whatever geography that census tract was in. So what we did was, in some of these cases, we had to take these multi-level measures and convert them to binary. And we did this based on suggested or recommended or accepted use in the literature. In our case, we used urban influence codes greater than or equal to 9, rural urban continuum codes greater than or equal to 7, and RUCAs greater than or equal to 4. Now, this is somewhere where I do want to point out that our results are dependent on this decision right here, okay? And you may make other decisions, or other people may determine rural status on some of these definitions using different thresholds, but I just wanted to point that out. These are the ones we used here. This required a little bit of GIS processing, but not a ton when we had some geographic mismatching units. So what we did was we calculated agreement, which is the number of times a tract was identified as being rural out of these 8 definitions. And so these numbers varied from 0, which is never identified as rural, all the way up to 8, which is this place was identified as rural in all 8 of these definitions. And so this is cool because it gives us kind of this idea of a consensus of rurality. It's not really a magnitude, but it does, you'll see the map, it does tend to be higher in more remote and scarcely populated regions. And then here, again, I'm not going to go through all this, is just this big laundry list of population characteristics that we wanted to look at how these varied across our different levels of agreement, and when looking at differences between rural populations and urban populations, given these different definitions. So what we did was we did an overlay of our rural definitions and our level of rurality metric with our population information. And we consolidated all these results. We're going to start with one of the first thing was just major differences in our different level or our different definitions of rurality and the number of people who are identified as rural. Now, again, some of these are determined based on our threshold, but you can see all the way from 75 million people in the US identified as rural in this definition down to, in our categorization of urban influence codes, just under 7 million. Right? So we have these massive differences and everywhere in between on just how many people we would count as rural in the US. Now, one of the cool things about this table that's included in the paper is it tells us about how much agreement is there between the different sets of rural populations here. And in this case, when you read this table across, it's basically saying, given this rural population, like the CDs or the HRSA's 57 million people, what proportion of that 57 million was also identified as rural by CDC and by RUCA and the RCC? And so you can look at agreement here across the metrics. Now you see mostly this is smaller levels of agreement for these larger ones. And then we have like urban influence codes and lots of agreement with the other one. So what's cool about this, so you get a lot of information here, but you can also look at this in the columns as well. And you can see something like HRSA's definition of rural captured all of the RUCA definition, all of RCC, all of urban influence codes, and all of the FAR. So you can also, interestingly enough, look at this table and kind of understand these definitions and how they're alike and not alike by just looking at this one table. Now here is our cool map of rurality agreement, and the darkest blue color here means that it was rural in all 8 of our definitions. And if it's like this lightest yellow, you can see in the urban regions, on the east and some of the large population centers, that these tracts just were not ever identified as rural in any of the definitions. And then you can see the spectrum in between, right? That these often go from this darkest blue into this lighter blues and then into the yellows. Now we also then aggregated information over these levels, which was really interesting. And again, I'm going to zip through a lot of this. There's more in the paper, but we found some really interesting findings that some population characteristics, like percentage of population that's white or Black or Hispanic, or percent of the adults that have depression symptom or reported as having depression, you can see there's like a cliff, a ledge that right when you go from 0 to 1, you get this massive change, right? Whereas other characteristics, you see the ledge at the other end, right? That it's from 7 to 8 is where you get that massive change. And then other ones, you just get these nice gradual changes, or it just kind of works its way up, like you can see with like diabetes prevalence. So we found some really interesting things about how agreement of how the variation in these population characteristics, how they actually varied across our levels of agreement. So the other thing we did was looked at the differences in some of these measures between urban and rural residents to look for large disparities, to see which ones actually captured kind of the biggest differences between the two populations. And what we've done here is we ordered them in this table by size. So like this is the most people, this is the fewest, and there's our definition. And you can see that because we had this kind of tight definition for urban influence codes, it actually did a pretty good job, right? That's this darker gray means that's the highest difference between urban and rural dwellers. But what you see is these ones here in second and third smallest, they actually didn't get all of these next second highest. When we're thinking about differences, that was actually the CBSA rural definition. They got first highest on difference in education and second highest difference between urban and rural dwellers on all these other metrics. So again, some interesting results on thinking about kind of the size of the population and what you're capturing. So notable findings. So we did find all this variation in size of the population. We think that this idea of agreement among definitions of rurality was interesting and might be useful. It's another approach kind of for people to put in their toolbox and to think about. And our disparities, they vary by definition, in that we need to consider the size of the rural population. Again, if you have this really tight definition of what is rural, you're likely to get kind of bigger disparities. So we were not able to uncover like a best definition of rural. I think what we did here was important. We were highlighting kind of differences and similarities among these different definitions. We do have some suggestions to use standard definitions. That's something we've read throughout the literature, and everything we talk to is like, don't create your own definition of rural, because then no one can compare your findings to anyone else's. And then again, consider your project and your data. Because we found such differences among the population characteristics and kind of among these levels of agreement, I think people should really just put some thought into what they're actually trying to capture before they decide. And that's it for the presentation. I want to thank everyone, and I'm going to exit my presentation view and turn it over to Davis.
Well, thank you, Paul. And I want to compliment you guys on your work. I'll say I'm a little bit envious because we had talked about in our Rural Health Research Center some time ago doing something kind of like this, because we grapple with, which definition should we use and how does that affect the results? And but you actually did it, and that's what counts. And so I really am pleased to see this work. And so I want to encourage, we've got a good group of attendees here, and I'm sure you have thoughts and questions, and I know some of the folks who are attending have a lot of thoughts about rural definitions. So I encourage anybody to ask a question, or if you'd like to make a comment. So use the Q&A to ask a question. If you have any comments, please use the chat. But I'll get us going here with something that you kind of touched on, but I wondered if you could go a little deeper in, Julia or Paul, in helping us to think about, so what are, what would be kind of your list of considerations that we should have in mind when we're trying to choose a geographic classification scheme? Just knowing that, there are people that have different sort of capabilities around this, dealing with geography, different levels of knowledge. But what are the key factors that kind of go into deciding which definition should I use, or definitions should I use?
Yeah. So one of the things that we found through our work is that it's clear that the definitions of rurality we studied are not exactly interchangeable. And so also we found, that conceptions of what rural means to people changes. And so I would first encourage people to think about why they want to include a dimension of rurality in their work. And so, that can involve asking kinds of questions like, what populations are we studying? Is there a state or more local context to consider rather than a national one? How do definitions fit in those contexts? And then most importantly, I think, is, are we looking at a broad category of rural for these sets of reasons? Or are we focusing in on a narrow kind of rural definition and therefore a more specific rural population? And then, it's also important to consider, okay, once we have the idea of the rural population that we want to study, what are we studying in that population? If you're studying economic patterns or access to healthcare, it may be more useful to include a rural definition that has some kind of connectivity schema, like the rural-urban commuting areas. But if it's health disparities or social determinants of health, the CDC's definition could be useful in that context. But we actually found also, as Dr. Delamater demonstrated, that the urban influence codes, when used kind of in a more specific matter, that's not a continuous, but a multi-level definition. When we applied a very strict constraint to that multi-level definition, we found that it was good at identifying those kinds of disparities in rural and urban. So there's population to consider, and then what we want to study in that population. It's something you also mentioned or alluded to was the kind of availability of data at different geographies. And we were lucky in our analysis because we were able to make the spatial calculations necessary to kind of evaluate all of the rural definitions within the same geography. We kind of brought them all down to a census tract level. But in their raw forms, they can be available at census tract, at the county level, and even zip codes and other geographies. We chose census tracts because we wanted to get at a more fine level of detail. Some counties are really big, and some counties have a lot of variation within, within that county of rural and urban. So I would say for a fine level of detail, if you really want to get at the subtle differences between rural and urban populations and areas, So we recommend census tracts, or I might, suggest census tracts, but I think if rural urban differences are one of many elements being considered in an analysis, counties are perfectly acceptable. And I think that's what a lot of folks have in terms of health related data.
All right, thank you. And I'll also put in a plug for the RUCAs, because sometimes we do have zip code and then you can get below the county level. But that is clearly, what data you have available is an important part of that. And so I appreciate your mentioning that. So you're hearing me okay? I just had a technical issue with my phone. So I'm coming through. Okay, good. And so there are some questions here, and I guess I'll address the first one about the count of, over 100 rural definitions. And this may be an urban legend, but I've heard this, I've read this somewhere, in just different parts of the federal government using different definitions, some of them program specific, or a rural legend. Yeah, well, it could be an urban legend given where I've heard this, but yeah, that's great. And so, but also, yes, I think the point about states is, of course, they have their own definitions. I know my own state of Washington, they use RUCAs, but they also have some modifications to that in their official definition. There's a question about how others have used the Am I Rural tool. And I'd be curious if people want to make comments in the chat about that. I know that if I'm looking at a particular place that someone has in mind, I do like to go there and check out, is that place really rural and according to whose definition? And but if others have insights in how they've used that, that'd be great if you could contribute those. And then there's a comment from Mark Holmes, one of the other co-author on this paper that's coming out, which it's not out yet. Do you guys know when it's coming out?
Soon.
It's coming out
we've
soon.
Heard.
Yeah.
Soon.
Well,
Yeah.
I know you've got the page proofs because you shared them with me, so
Yes.
that means hopefully soon. But Mark makes the comment that these definitions are all geographic based, and he wants to know, what are your thoughts on moving to rural definitions that include non-geographic components, socio-demographic indicators, and he comments that some of the continuous definitions move in that direction. So thoughts about that?
Yeah, I mean, I think that's an interesting direction to head in. I think just from my point of view and from what I've seen comparing these definitions in our work, it seems that we need a little more research to support maybe some ways of predicting where rural populations might be based on non-geographic indicators, because there's just, I think, a little more that needs to happen there. But I do think that is a direction that we can move in, to maybe be capturing some populations that are left out of one or left out of another, and maybe get a little more agreement between the definitions. But yeah.
I'd like to add real quick. I think that's a great idea, but I do think that it still leaves the same issue, or some of the same issues that we had before, which are, we still need to pick the measures and kind of pick thresholds, and again, finding which components are kind of capturing this characteristic of what we are saying are rural residents. I think that's part of the issue here, is that it is this multifaceted concept. And so, I do think the idea, though, of integrating socioeconomic, sociodemographic, and geography is probably the way to go.
And I'm wondering, this is a health workforce, technical assistance center webinar. Are there definitions that you would recommend or think of as particularly apt for doing workforce analysis?
Yeah. So I think what we've talked about is still best practice I think, to think about still why we want to be using a rural dimension in our analysis and what the purpose of including that is. With workforce, I think there's also an important element of, okay, what workforce are we looking at? You know, is this physicians, nurse practitioners, LPNs, and what populations do we want to target for access or workforce development? That extremely isolated or more broadly rural. And as we've talked about, I think for most contexts, it's helpful to work with definitions that are standard practice. And for most people in health workforce, I think that would be the RUCAs or core-based statistical areas, or even the Federal Office of Rural Health Policy's rural definition, which is very similar with a few differences to the rural urban commuting areas. But as I said, you know, I do think it's worth spending some time in each analysis thinking about, you know, if we're using core-based statistical areas, what the metro and the non-metro definitions mean and why they are standard practice, and what the usefulness is of that definition, because I think that was something that was illuminating to me in this work.
I send a lot of students to use RUCOs. That I feel like that one is ultimately pretty interpretable. It's used a lot. I feel like it's at least on the research side of things. The one thing I've been getting recently, though, which is again to you know, add another layer of complexity of this, is people have asked about, and this ties into Anne's question, asking about definitions for urban, is a lot of people are asking me, I want to capture suburban. I want the suburban. And we actually, I mean, you look at all these definitions and you won't find that word anywhere in any of them. You'll find urban, you'll find metro, you'll find micropolitan, and you'll find rural in some of these definitions. But that idea of suburban, we never find. And Anne, I think that there are as many definitions for urban as there are rural, because that's, you know, often the case is our rural definition in some of these is everything that's not urban. And so they define urban, and then the rural is kind of often the leftover in many of them, right, Julie? Isn't that a couple of them? It's like urban and then rural is everything else, or there's metropolitan, micropolitan, and then
Non-metro.
everything else. Yeah. So yeah.
One thing that, go ahead, Julia.
Well, and whenever we talk about suburban in this context, it always makes me smile a little bit, because I think even more than our kind of like social concept or like kind of cultural idea of what's rural, suburban there's a whole idea of that as well. And that's even less defined and even more of like a kind of social cultural concept. So that's a super tough question that we get sometimes, for sure. But go ahead, Davis.
Oh yeah, I just wanted to point out that, you know, some of the more fine-grained, and I'm going back to RUCA just because I know it the best, but you know, there are multiple urban categories that get lumped together, and most often in the work that I do. But we have had some discussions from time to time about, well, maybe we should break urban down, because often when we do rural versus urban comparisons, we're sort of setting up urban as the standard, which, you know, that's problematic in itself. But urban is not one undifferentiated lump. And in fact, there's different parts of urban that are better served and less served. And so we thought, well, maybe we should try to look at, you know, for some problems, for some questions, it may be that the suburban areas are doing best or have the most access or have the best indicators of, or not. And so maybe that should be, if we're trying to like ensure equity of access across geographies, maybe we should be picking the population geographically that has the best access, and that could be a suburban area, for example, and using that as our metric. Then there's a really interesting question: which definition would you use if you're looking at rural older adults and healthcare access in the Midwestern states? And I love the specificity of that. What are your thoughts?
Okay, play that back to me again.
Yeah,
older
sure.
adults in Midwestern states.
rural older adults and healthcare access in the Midwestern states.
Mm,
So I can
Go ahead.
hop on here quick. So that was one where, so like, if you're talking about access, if you're talking about geographic access, we actually did find some interesting things there, because I'm gonna reshare again
Yeah,
real
please.
quick, because this was one of the more interesting ones. And Julia, I remember when we were looking at this in this table, that our percent of the population within 30 minutes of a hospital, within a hospital with 100 beds, like a larger hospital, within a dentist or within primary care, we actually found that the CBSAs actually did quite well. Again, the UICs were that really tight definition, and so there's not a lot of people defined as rural in this one, but the CBSA was actually quite a few people. I guess it's 18 million as rural, but did a pretty good job identifying disparities in geographic access. So that was just one that popped into my mind real quick with that question.
Yeah. And again, CBSA's fairly standard practice. I think again, there's good justifications for several rural definitions. So again, CBSAs work well. I would also maybe point again to RUCAs, since that is so frequently used. But yes, that sounds right to me as well.
I'll also point out a comment in the chat, and it's about instead of perhaps creating division by trying to divide up, rural versus urban, separating rural and urban serves what purpose. Underserved populations and health disparity in communities seems to capture what public health addresses, and not simply geographic measures and boundaries. And I guess I will just comment that I do sympathize with that perspective. At the same time, we do know that there are sort of unique challenges that different populations face depending on just the geography of where they reside. And so I don't know that we can completely, and in fact, based on the work that I do, which is a lot focused on rural, I don't think we would want to throw out rural and urban in thinking about that. But I do think the underlying motivation is to address disparities and achieve health equity. And so I think that also points to the need that within rural analysis, we need to be looking at other aspects of disparity, which I think Mark Holmes commented about too as well. So it really is, I think it's a both and, I guess is what I'm trying to say.
I agree. And I would say, I mean, in the comment, just asking the question of why am I wanting to separate or segregate these populations, or why do I think there is a disparity? I feel like that's like step one in this, and that is a great place to start. And that's honestly I work with a lot of students in Gilling School of Global Health, and a lot of PhD and master students who are doing either health outcomes or health services research, and they say, I want to do geography. I want to classify everything by urban, rural. And I was like, well, one, that's not geography, but my first question is why? What is it that you think you're going to find, or what is it do you think is interesting about this question between these different, dwellers of places? And I often ask them, why do you think there would be differences? And often we can walk through things that they don't need that measure. They're actually thinking about characteristics of people that we can capture much better than this kind of nebulous concept of urban rural that we put a very hard threshold on this nebulous concept. So
yeah, I also think that that's such a useful question in any kind of research that's seeking to talk about any kind of like health disparities or health equity work. You begin with the why these kind of subpopulations, and what is the purpose? How is it contributing to this hypothesis, this analysis? Because yeah, I mean, it's always easy to throw a rural urban or a black white, like non-Hispanic white, non-Hispanic black into a regression. That's not hard, but the hard part is understanding why it's important to the work.
Yeah, being able to justify why you even did that analysis in the first place.
Exactly.
If we just look for differences without a reason, that is problematic. There's another question there, but there's a couple of points. Now we just have a couple of minutes left, related to your paper coming out and also availability of slides. And maybe I'm thinking about the dissemination, and I might even ask David to weigh in here. Is there a way for folks to, for this paper to be sent back to the webinar participants? Or Paul and Julia, how would you like to hear from people to disseminate the paper? And I will put in an additional plug. I saw that there's a rich supplemental material besides the paper itself, which I didn't have a chance to look at myself, but so there's much more than just what you saw in the slides that could be helpful. What about dissemination of slides and or paper?
Well, I can speak real quickly. We generally share the slides along with the video on our website. And the video should be ready to be posted in about a week. And as far as the paper goes, once it's published, just send us a link. I know there might be some firewalls, et cetera, but we can certainly,
it should be open access.
Oh, okay, good. I missed that, sorry. But we can certainly put a link on the website as additional resource along with the webinar.
Yeah, happy to do that as soon as we hear word. So thank you so much.
Okay, good.
Great, and we just have a minute left. I think it's worth, maybe these are the last words given to your co-author, Mark Holmes, a hard question. And he says, the posture this analysis takes is what definition best predicts, oops, it just disappeared in my view.
That was me. Because I answered. I said that.
Oh, you answered it. Oh, there we go. Yeah. But anyway, I think the question is what definition best aligns with what people self-describe. And there's actually been some work on that, but not enough in my opinion. And I often find that I don't think that rural urban definitions, as we, the standard definitions align very well with people's perceptions. And I think a lot of people over-identify as being rural or, compared to other definitions. But I think there's also been work that shows that some people that identify as urban are actually rural according to some definitions. And so again, it gets this mixed up sort of alignment. But I think self-perception can be important. And so that is a really great question. And maybe we ought to leave it there, but thank you for that thought, Mark. So David, did you want to close this out?
Yeah. I mean, we are at the mark. With that said, I thought it was a wonderful presentation, and thank you very much, Davis, for moderating. I mean, it was very appropriate to have a director of a rural health research center moderate this event. And I know personally speaking, as someone who has struggled with defining urban and rural areas in New York to look at health workforce issues and generally settling on using something called Ebert's typology, a New York State definition, which was made decades ago. I found this information very informative. With that said, thank you once more, and thank you in the audience for attending our event. And we, of course, hope to see you again in the future. Thanks, everyone.
Thank you all.
Thank you.
Thank you for watching the webinar. To view our extensive webinar library and other helpful resources, please visit us at healthworkforceta.org.